Hey, Alicia, earlier the vet mentioned a tension pneumothorax. I know pneumothorax means air in the chest, but what exactly is a tension pneumothorax?
Kenna, that's a great question. Let's start with the basics. So, a pneumothorax happens when air gets into the pleural space, which is the space between the lungs and the chest wall. The air pushes on the lungs and can make them collapse partially or completely.
So the lungs can't expand properly when the animal breathes?
Exactly.
Okay, that makes sense. So what makes it a tension pneumothorax and how does that differ from the regular pneumothoraxes we see through the ER commonly?
A tension pneumothorax is a much more dangerous version of that. It happens when air enters the chest cavity but can't escape. So, think of it like a one-way valve. Air keeps going in with each breath, but it gets trapped.
So the pressure just keeps building?
Yes, the increasing pressure is going to compress the lungs and going to push the heart and all the major blood vessels. When this happens, blood can't return to the heart properly, which can lead to shock and cardiovascular collapse.
So these cases are very critical.
Yeah, they often require immediate stabilization.
How do veterinary patients end up with pneumothoraxes in the first place?
There are several ways. It can be trauma, being hit by a car, penetrating chest wounds, a ruptured lung, bleb, or bulla, or iatrogenic causes. Some iatrogenic means that we can cause it. So, from like procedures like a thoracocentesis, NG tube placement gone wrong, mechanical ventilation.
What signs should we watch for in our patients?
So the common signs are going to be severe respiratory distress, rapid shallow breathing, open mouth breathing in cats, muffled lung sound, a distended chest,
How do vets confirm it?
often with thoracic radiographs once the patient is stable. So, but if we suspect a tension pneumothorax and the patient is crashing, we don't want to wait. We need to treat immediately.
How do we treat it?
The main treatment is going to be a thoracocentesis.
That's where we insert the needle into the chest and remove the air.
Exactly. We place a needle or a catheter in the pleural space and aspirate the trapped air with a syringe. That relieves the pressure so the lungs can expand again.
And what happens if the air keeps coming back?
Then the vet may place a chest tube that allows for continuous removal of the air until we figure out the underlying problem. These guys may require a CT or imaging and might need to have surgery to correct any other underlying issues.
Do they require oxygen therapy?
Definitely, many of these patients go straight into oxygen support until we stabilize them.
So, just to make sure I've got it, the pneumothorax means air in the pleural space, causing lung
Mhm.
collapse. Tension pneumothorax is when the air enters but can't escape, the pressure builds, and it compresses the lungs and the heart.
Perfect summary. The big takeaway is the tension pneumothorax is life-threatening and requires immediate stabilization.
Thanks, Alicia. I feel a lot more confident about recognizing it now.
Anytime, Kenna. In emergency medicine, understanding conditions like this can literally save a patient's life.
You can say that again.
Anytime, Kenna. In emergency situations, understanding conditions like this can literally save a person's life. Good job.
Yeah.
Okay.
Done.
Bye, guys. This has been our episode of Conversations with Kenna this week. Bye.